Good afternoon, fellow participants. Today's program is one of the important programs that we are going to have. As we can see, the topic of today's presentation is Equipment Inventory Systems and Standardized Nomenclature. And this is presented together with Ghana Medical Health. I would like to do a few introductions of some personalities in this program today. We have Dr. Dominic Akaateba. He is the country director of Ghana Medical Health. He's a co-presenter. We have Dr. Bill Gentles. He's a member of the Canadian Medical and Biological Engineering Society, one of the main facilitators. We have Kelly Hartfield. She is the founder and director of Ghana Medical Health. You have Martin Poulin. Martin Poulin is a member of Canadian Medical Biological Engineering Society, one of the co-facilitators. And of course, myself speaking, John Zienaa. I am working in the Ghana Health Service, in the Clinical Engineering Department. I'm a co-facilitator. Behind the scenes, we have Clement and Sebastian, who have done all this PR work for this to become successful. A few comments and remarks about the topic today. We all know the importance of inventory. It serves as a basis of planning tool for acquisition of healthcare technology. It makes you abreast with your stock of equipment. It allows you to continue assessing the state and health of your equipment. It will, you'll be able to project for your future needs using your inventory. You'll be able to determine the appropriate budgets for acquisition and your maintenance activities. There's a lot more to hear from our main presenters. They will introduce us in details to this topic today. So I will indulge your audience, pay attention, and then keep all your questions at the end of the webinar. Then you can ask whatever question for clarification. I'll hand over the program to Dr. Bill Gentles to continue. Thank you very much.
Thank you, John. Bill Gentles here. It's a great pleasure to be here today and to participate in this webinar. Now, without further ado, I'm going to hand it over to Martin Poulin to present the first part of the presentation. Over to you, Martin.
Good afternoon, everyone. I'm Martin Poulin. I'm happy to be here today. So we're going to go over equipment inventory systems and talk about nomenclature. And so what we're going to talk about is listed here. So we're going to start with talking about the uses of an equipment inventory. Then we're going to talk about the essential data elements in an equipment inventory. Talk briefly about the challenges in establishing an accurate inventory. And then we'll talk about the UMDNS Nomenclature System. We'll explain what that means. Then we'll talk about the computerized systems for inventory management. And then we'll talk about the modules that the Ghana Health Group have put together in their database. And then we'll talk about the steps in implementing a computerized maintenance management system. So, first of all, what are the uses of an equipment inventory? So, as John reflected, an equipment inventory can be very useful and valuable, and it's actually core to the clinical engineering department function. You can use it, first of all, to develop budgets for capital procurement planning and for all ongoing maintenance and running costs with that inventory information. Two, you can use it to build and support an effective clinical engineering department that allows you to justify, workshop needs and the amount of staff that you may need or that you need to train. 3, you can use it to establish and maintain service contract information. 4, you can use it to plan your preventive maintenance activities and to actually track that activity. Next slide. 5, you can use it for parts inventory. So you can use it to plan the stock of your spare parts and your consumables. You can use it to support equipment needs assessment within the healthcare facility, knowing what you have and what perhaps you need. 7, you use it to record the purchase information, the receipt, the retirement, and the discarding of equipment. So it's you have an organized inventory. You can use it to conduct a facility risk analysis. And number 9, you can use it for emergency and disaster planning. So if you know what inventory you have at a moment's notice, you can explain to your leadership, where that equipment is and where it can be deployed as needed. Oh, back one. Oh, there we go. So what are the essential data elements of an equipment inventory? So the first one is a unique identification number, which is typically listed as a barcode number. So that's right at the top. You may have an old inventory number that you want to reference. And then what's important is the generic or family name of the equipment, and then the specific name. And we've got in brackets the UMDNS, which we'll talk about a little later on. And then some basic information like manufacturer, model number, model name being if it has a common name that you usually refer to it, serial number. And then it's important to understand where the equipment is, who the user contact is, where it's located, including the name of the institution, the district, and the health region. You may have a service contract on the device, so you want to know who the maintenance provider is, and you'd like to know who the name of the supplier is and the country of origin of the device. You also, other useful information that you may want to have in your inventory includes the year of manufacture of the device, when you purchased it, when the warranty expires, and what's also useful is when the inventory was actually taken and or updated, and who actually did the updating. It'd be nice to know if you have a user manual or a technical manual, and it'd be nice to know if it was purchased from a particular project, what the present condition of the equipment is, whether you need any spare parts and accessories and whether they've been delivered, whether it needs any special tools to maintain or do preventive maintenance on the device. And perhaps you want to track the installation of the equipment. And of course, the purchase cost, or at least the value or the replacement value of the equipment is very important. And also, what is the preventive maintenance interval that you hope to regularly inspect the device? Next one. So what are some of the overall characteristics of an equipment inventory? Well, the first thing, it would be desirable to have it uniform across the whole organization. So if you have the same template, the same fields, and the same nomenclature system, this allows you to draw reports on the status of your inventory throughout the whole organization, which is quite useful. You're also able to make comparisons between your different facilities in terms of equipment needs and or service provided. Now it's important that this data, this inventory data, is collected by staff who actually understand the equipment. And so we're talking about technicians and clinical engineers who actually understand and what a device is called, what family it is, what is the subcategory or specific name of the device, so that you can enter the inventory consistently. You also have an opportunity to do, it's important, to do periodic checks on the quality and the completeness of the data in the inventory to ensure that it is maintains and its accuracy. Now, what I did want to point out, though, it isn't actually a fair amount of work to establish an inventory. So it's not just something you can do on the side of your desk. So as indicated before, what is really important is that each item has a unique ID number, and typically in a barcode fashion label on a device. That's important because database systems rely on each asset to have a unique identification. Otherwise, you're going to get confusion. You can't have the same item with the same information because that ID is unique. And you want that ID to be unique across the entire system so that you would be able to draw on, again, the inventory system throughout your whole organization. Now, we usually place that ID on the front of the device so that users can see it, so that they can also, when they're making a work request, they can say, oh, I have this number that I would like you to work on, please, and this is the problem. And so it also makes it, because the user may not be aware of what the device is called. And these unique IDs can be assigned very simply, sequentially by a central coordinator to ensure that there's no duplication. So what are some of the challenges in establishing an accurate inventory? Well, the first thing, of course, is that you may have limited capacity at some of your hospitals and clinics. They may not have technicians or engineers on the ground. So having someone that, again, understands the technology, they may not be available. Second, your leadership or administration may or may not see the value in actually collecting an inventory. So it's important for us to explain the value of an inventory in order to move forward. You may have traditional paper inventories on hand that are, well, they may be non-existent or they may be fragmented. And so we hope that we'd be able to put it onto a computer so that it is again, consistent and common throughout all your particular sites. And also what's important to know, that of course, it's the dynamic nature in inventory, because of course you have some equipment coming in, some equipment that's retiring, some equipment that's beyond repair. So it's quite dynamic. There's always some equipment coming in, some equipment leaving. So it does require strong administrative structures, including supervision, quality assurance, make sure it's being done correctly, and training. And I think I'm handing it over to Bill now. Thank you.
Thanks, Martin. Okay, I'm going to talk a bit about the UMDNS Nomenclature System. This is a system for medical devices only. It's a set of standardized names with definitions and a unique number that corresponds to each name. An example, and I'll give you several examples just to give you a flavor for how this works. And so a common device that you'll find in your inventory is autoclave. However, the word autoclave, the term autoclave, is really a non-standardized device name as far as UMDNS is concerned. And that's because it's not specific, and it could refer to many different types of sterilizing equipment. So in the UMDNS, there are numerous different standardized names for different types of autoclave. And the most general one is sterilizing units, and there's a 5-digit code associated with that name. But then it gets into more specific names, and I'll just list a couple of these here. Sterilizing units steam has a different code, and sterilizing units plasma, again, has a different code. So what we're hoping to get everyone to move towards is using the set of standardized names when they're taking inventory. And we'll get into more how that's going to be made possible as we progress in this presentation. Let me give you some more examples. But first, just an explanation. UMDNS is an acronym. It stands for Universal Medical Device Nomenclature System. And it was established by an American not-for-profit agency called ECRI, ECRI, used to be, use their full name, Emergency Care Research Institute. And they publish information on medical devices. They do evaluations of medical devices. They publish hazard alerts on problems with medical devices. And they've also developed this international standardized nomenclature, which they make available at no charge for anyone who wants to use it. And so we're recommending that this UMDNS nomenclature system be adopted throughout Ghana to standardize the way you describe your inventory. And in the next few slides, I'll illustrate why that's going to be important as we move forward with the inventory. First of all, it has been officially adopted by more than 100 countries and is used for inventory, classification, and regulatory purposes. So it helps with your medical device regulations if everyone knows you're talking about the same kind of device. And it's used in the databases and publications of ECRI, or the Emergency Care Research Institute. All of their hazard notices and bulletins about problems with devices come out with the nomenclature and the 5-digit code associated with that device. So that if you're using the same set of nomenclature, you can quickly determine if the hazard that ECRI is reporting on is part of your inventory. I think somebody needs to mute. We're getting some microphone noise. So standardized names, as we illustrated before, have two different parts. There's a generic name and a specific name. And then there's a numeric code for each of the above parts. And I illustrated that with autoclaves. The examples now, I'll talk about these. These were, we were provided with some inventory data from some of the engineers in Ghana. And this is something I extracted from one of the Ghana hospitals in the northern district. So under suction equipment, these were 4 different entries for exactly the same device, but they had slight variations in the name of the device. And so if you had wanted to generate a report saying, how many suction machines do we have in the Northern District? You would only get the ones that were labeled suction machines. You wouldn't get suction equipment, you wouldn't get suction unit. And sometimes it was misspelled with an extra N in there. So there's a problem with using non-standard nomenclature where everyone just sort of uses the name they're familiar with for a device rather than using a common name that everyone has agreed on. So if we go to the UMDNS dictionary, where you can look up a suction unit, if you look up the term suction unit, it says that's not a precise or specific enough term. So the term used by UMDNS is aspirators, which really means the same thing. An aspirator is something that sucks fluids. So the generic name would be aspirators, and the code is 10208. The specific name for the suction machines in this Ghana hospital would be aspirators, airway. So it's an airway aspirator rather than a surgical aspirator used in the operating theater. And it has this code. So as part of the implementation of the inventory system here, we're going to be making available this dictionary of standard terms, and we'll limit it to the devices that are used in Ghana because it's a huge dictionary with a lot of different terms in it. And so we'll start with a subset of that, and you can add to it from the dictionary as you expand your inventory. So another example from another Ghana hospital is a listing of the autoclaves. So some of them were described as autoclaves, others were described as autoclave sterilizer. So those are pretty close, but again, the UMDNS dictionary says that the term autoclave is too non-specific. And so it points you to the standardized term that they use, which is sterilizing units, steam. There are other sterilizing units that use other media besides steam, but in our case, in these examples, these are steam sterilizers. So the standardized generic name, sterilizing units, steam, has a code 13746. Then getting more specific, we have several different kinds, and I'll just show two of them here. A specific name would be sterilizing units, steam, tabletop. So a tabletop sterilizer is a much different animal from the next one, a bulk floor-mounted sterilizer that you can wheel carts into, full of surgical instruments. So there's a totally different name for sterilizing units, steam, bulk, code 16141. And so it's important when you're entering data into the inventory that you make the information as specific as possible, because if you're counting tabletop sterilizers and mixing it in with bulk sterilizers, it doesn't really give you a good picture of how many of a particular type of sterilizer you have. So the inventory that we're proposing to implement, it will allow you to do this fine separation of these detailed specific names. And another example from a Ghana hospital, patient monitors are commonly found in many hospitals, and they're often referred to with different names. Here we have the first. Can you spot the difference between the first and the second one? There's a spelling error in the first one. And this is a common problem with inventory where people are, as I mentioned before, entering data rather than clicking on a standardized list. So we have three different names here for patient monitor. And if you did a report asking for how many patient monitors do we have in the Northern District, you'd miss out the vital signs monitors, and you'd miss out any patient monitors that had a spelling error. Because database programs are, as with many computer programs, they're very unforgiving of spelling errors or typing errors. So from the UMDNS dictionary, if you type in the term monitor, it points you to the standardized term, monitoring systems, physiologic. So a physiologic monitoring system is different from a computerized monitoring system where you have display screens up on the wall. So you have to be specific about what kind of monitoring system you're talking about. So the generic name, monitoring system physiologic, has a code 12636, but then to get more specific, the ones that we're really talking about, which are in many cases referred to as vital signs monitors, are in the UMDNS dictionary. They're called monitors bedside physiologic. And you'll notice the terminology here has a specific format. It starts with the most general descriptor, monitors, and then it narrows it down saying they're bedside monitors, and then it narrows it further saying they're physiologic, they're monitoring physiologic parameters. So the structure of the terminology goes from generic terms to specific terms, and within each of those terms, again, they go from the most general to the more specific, separated by commas. And now one last example, which is a slightly different appear slightly differently in the dictionary because the oxygen concentrator is a very specific device, and there isn't really a lot of variation in oxygen concentrators. So the generic name in the UMDNS dictionary for oxygen concentrator is oxygen concentrator. Now, you'll notice they always use the plural, which is a bit of a quirk of this dictionary. It's based on the ECRI product evaluation system, where they talk about many different brands of oxygen concentrators. So they always use a plural in the dictionary terms. So the generic name, oxygen concentrators, and the specific name, oxygen concentrators, are the same because there's nothing more specific that you can say to describe an oxygen concentrator. So that's the last example I think I have. Now I'll talk a little bit more about why it's important to have this standardized nomenclature and use it whenever you're developing your inventory. You need internationally agreed on names to identify the medical products so that you can talk to each other with the same language about these devices. You often have to communicate. Well, do you have, you ask another hospital, how many patient monitors do you have? Well, what do you want, bedside monitors? So the specific terminology helps people talk about the same product or device. And it also helps you with information about hazards or recalls or failures of a device. If people in one part of the country have had a lot of problems with a specific device, and they send information around on the WhatsApp channel or any other communication channel saying, is anyone else having this particular problem with this particular device? It's very useful if you're using the same terminology to describe the devices so everyone understands what you're talking about. So there are many different reasons why standardized nomenclature is important. Inventory is just one of them. Device regulation is another. Health technology management is a third one, and that's a very broad term that's becoming more and more widely used to talk about what clinical engineers do on a higher level to manage the devices across the health system. It helps to keep track of inventory, reallocate inventory, identify which makes or models of devices are less reliable, and perhaps make recommendations about procurement, which talks about then the importance of communication and equipment planning. So if you're planning to purchase another whole fleet of patient monitors or oxygen concentrators, maybe you've got some grant funding from WHO during this pandemic. There's money coming out to purchase oxygen equipment on a large scale. But before you know how to distribute that, it helps if you know where your existing oxygen concentrators are in the country. So equipment planning is a very vital use of standardized nomenclature and an inventory system. So talk now a little bit about computerized systems for inventory management. So you can take inventory, as Martin has mentioned, you can start with paper records, but it's strongly recommended that it's preferred to use some kind of electronic data entry system. And the easiest way to get started, and we've seen a number of these quite comprehensive inventories on Excel spreadsheets. So the easiest way to get started with inventory is with a simple spreadsheet or a database program. So we're going to be transitioning all of your information that we've received on Excel spreadsheets into this new database. And the importation of data from Excel spreadsheets to database programs is fairly straightforward. So, and I'll show some examples of that in a few minutes. So then as I mentioned, it's fairly easy to migrate the spreadsheet data into a database. We're going to be using a Microsoft Access database, but widely used in Canada or the US are commercial systems called Computerized Maintenance Management Systems, or CMMS. They're fairly expensive, so mute your microphone, please. So a CMMS can generate reports in support of management, analysis, and decisions. So one of the tools of any database system, including a CMMS, is the ability to generate customized reports, giving you information on specific categories of equipment, locations of equipment, condition of equipment. So the CMMS, or the database that we are going to be implementing for Ghana, has the capability to record all repair and maintenance history for a particular item included in the inventory. Once you've got this kind of information in a database program, then you can start to see trends. You can do reporting to identify trends in failure, assisting in troubleshooting. So if a specific problem has occurred in one part of the country and it's been documented in the database, it will help other people who are encountering the same problem perhaps a month later to realize that somebody else somewhere else has found the same problem and has already come up with a solution. So you can save hours and hours of troubleshooting time if you can share this data in a consistent fashion with each other. So some of the features of a CMMS that you find useful are tracking work orders and generating reports on open work orders. So we use the term work order to define, or it's a job ticket, perhaps you might call it. We use the term work order. You can generate reports on all your work orders that are currently pending completion. We call those open work orders. So an open job ticket or an open work order is something that management needs to be able to keep track of and look for areas where there are problems. Perhaps a specific kind of device has a very long lead time to get the spare parts. So you've got two different brands of oxygen concentrator. With one, the spare parts you can get in a week, and the other one, it takes 6 months. Once you've got this kind of database, that you can quickly collect that kind of information across the whole country and make some procurement decisions based on things like availability of spare parts and how quickly you can get them. You can generate reports on repair turnaround times. How long does it take you to repair certain brands of equipment compared to other brands of equipment? Maybe you need more training on a specific device. Repair turnaround times can tell you all kinds of information. Once you gather that information in a database, it can tell you all kinds of things to make decisions on to improve your service. And the third useful feature of a database is that you can get it to automatically create a work order for a scheduled preventive maintenance job. If something has to have its filters changed every 6 months, once you have this database program working and you've put in the preventive maintenance schedule for that device, the program can automatically spit out a work order and either print it or send it as an email to somebody. So keeps track of things that you need to do on a regular basis and keeps and reminds you of those without you having to do a lot of work to keep track of them. So now I'm going to go through a list of the fields that we are including, and actually you saw this list in Martin's earlier presentation, but just go through it again to give you a second look, because we're looking for feedback from everybody in Ghana who's working, all the clinical engineers in Ghana who are working on medical equipment, because we're still designing this database and we want to make sure that it is useful for the people who are going to be using it. So I'll just go through this again, and I want you to try and make notes if you think there's something missing or you find something ambiguous or confusing, don't understand it, and we'll get into the answering any of your questions or comments on this at the end of the presentation, I think. So barcode number is something that we don't have yet. We were actually planning to come to Ghana with a barcode label printer and several barcode scanners to start implementing this back in April, but then something happened and now there's a pandemic and we can't do what we were planning to do. So this field will eventually be filled with the numbers on the barcode labels as the barcode system gets implemented, which may take another year. In the meantime, some of your inventories on Excel spreadsheets have inventory numbers assigned to them. I've noticed some of them have a field for inventory number, but it's been left blank. You can arbitrarily assign those numbers in your Excel spreadsheets to at least give you a unique identifier within the spreadsheet that you're using for that specific hospital. Then we have equipment generic name and equipment specific name. Now, in the Excel spreadsheets, we'll be importing data into the generic name field, but then putting in a lookup table for UMDNS specific terms that we would ask you to enter into this second, more specific field. That's after we've got everybody a copy of this database. Now, then, of course, the common things you have in the inventory: manufacturer, model number, model name, serial number, user contact, location, name of institution, district, health region. Now, when you're taking an inventory, the most essential information is probably in the left-hand column. And then as we move through these columns, you may not immediately have all of this information. So an inventory is a kind of a dynamic document. It's never static. And every time you call up an inventory, the inventory data on a medical device, you may have some more information and you can fill in another one of these fields. Maybe you didn't know who the appropriate user contact was when you first took the inventory. But then the next time somebody calls you and says they need service on this device, you say, oh, are you the prime contact? And you can actually update your inventory with that information. Location and room, name of institution, district, all of these things can be put in as drop-down lists that you can just click on to enter. And we're starting to implement some of those lists, and there'll be more of them as you receive copies of the inventory. So maybe you've got a full service contract and you need to know who to call when the device needs service from the outside service provider, or it's under warranty. The name of the supplier that you purchased it from, the country of origin. Now, that was just the first half of the list. As Martin showed you, the list gets quite long. There are actually about 30 fields in this database currently. Year of manufacture can be useful. Donated equipment often comes to you that it's already 5 years old. It's helpful if you know the year of manufacture. If you then have data on the life expectancy of the device, you can project when you're going to have to replace that device. Or date of purchase, if it was purchased. Date the warranty expires. If it's under warranty, it may not be. And this, again, every time you access data in inventory, you have an opportunity to update the data, add maybe information in one of the fields. So every time you make an update to the inventory, you should change the date here and enter the name of the person who's done that updating. And Martin covered some of these other ones: user manual, technical manual, type of project, present condition of equipment. Now this is actually a very important one, because when you're taking an inventory, It's also important to include in the inventory all of the devices that are currently out of service, but that are potentially usable provided you could get the appropriate parts or supplies. So the inventory should include equipment that is currently not in service, but is repairable. So the database for this field is going to include a drop-down list because there are 4 or 5 standard terms in this field that we'd like you to use. Present condition of equipment. The first one would be like new. Is it brand new? Is it brand new equipment? Is it worn but functional? Is the equipment maybe a few years old but still working fine? That's another standard term we would like you to use. A third term would be broken but repairable. And so if you're waiting for parts, or it's been broken for a year, but you think maybe if you could only get this one part, you could get it working again, then the condition would be broken but repairable. Then there's another one, broken but non-repairable, beyond repair, broken but beyond repair. And so there are 4 terms there that we could put here in a pull-down list, but you can add to that. Maybe there are items that are beyond repair and useful only for spare parts. Maybe there's a broken device that was donated to you but never got working, but it has some useful spare parts in it. You should inventory that device so you know you've got a source of spare parts in this broken device. Again, you can enter that in present condition of equipment. So again, something else to keep in mind when you're taking inventory is not just your working devices that are in good condition, and any spare parts that are needed or delivered, special tools, installation progress. So here you could enter when the date of final acceptance testing, so that you know once the first day it was actually placed into clinical use. So that's an important, especially if it's under warranty, you need to know when it was finally accepted by the hospital. Purchase cost, PPM interval, and we can talk a bit more perhaps in the discussion about how you would establish what the PPM interval should be. But we're trying to encourage people to move towards doing some schedule maintenance on at least some of the more critical devices and identifying what those schedule maintenance intervals should be. And then a field for comments, because you can never predict everything that you need to put in these databases. So here's an example of the inventory form that is a draft currently. We received this from John Zienaa, and we've done some work on it to add some fields and a few functional things like some buttons at the top. So if you enter, say you're looking for a specific autoclave, and you know it's in the Upper East region, you can click on this button that says Find Record, and it will open another window that allows you to search for any one of these fields and enter some data and get it to find that record for you. If you're adding inventory, you would click on the Add New Record button, and it will clear the form and allow you to enter new data on a new device that you're just taking inventory on. So these are all the fields that I listed in the previous list. This is what the form would look like where you enter them. And I've just illustrated one of the drop-down lists that we're starting to implement. So the health region, John Zienaa sent to me a list of the current health regions in Ghana. So we've put that in a drop-down list, and I think the next slide illustrates, no, maybe it is. In one of those, I've got, yeah, no, I'm getting ahead of myself. So I've just blown up the first few fields in the form. to show you, it's a little hard to see on the previous slide, the small type. So the first few fields would be barcode number, old inventory number, equipment generic name. Now this gives you an idea of why the barcode number is important. So you've got a lot of autoclaves in the health district where you work, and you're looking for a specific autoclave because it needs some repairs. If you know the barcode number of that autoclave, you can enter it here. It's typically a 5 or 6 digit number, and you don't have to enter any other information or do any searching. It'll immediately bring up all the information on that device and allow you to update the inventory or enter any maintenance activities you're doing in, and I'll talk a bit more about the maintenance and repair form that we're also developing for this database. So that's just a close-up of some of the fields where you can enter data and what they look like on this form. Now the next slide, this is where I'm talking about implementing pull-down lists for some of the standardized information in the database, so you don't have to type in this information, but it helps if you've got this information as part of the inventory data, so that when you send this inventory data to a central office, they know which district it comes from or which health region. So if you click on that field, there you'll see there's a drop-down arrow on the right-hand side of the field. If you click on that arrow, a little window appears in front of your form with a list of all the health regions in Ghana. So you just scroll down to Upper East, click on it, and then you get Upper East in that field of the data entry form without having to type in any data and without making any typo mistakes or spelling mistakes or whatever, as we've seen in some of the nomenclature examples. So these pull-down lists reduce the amount of typing you have to do and avoid spelling mistakes and help with standardizing the information entered into the database. So again, we see over in this field, present condition of equipment, operable and in service. So that's sort of a non-standard term because everybody's going to be using slightly different ways. So part of the implementation would be to convert some of this information into a more standardized format that's on a pull-down list. Okay, so moving on to the next slide, we're going to talk a bit about the maintenance module in the Ghana database. So currently this is a separate module in a separate database. It will eventually be merged with the inventory because they're both using the same inventory data. So currently, these are the fields in the maintenance module. And the first few look quite similar, except we start with here a job number or a work order number. And that term we can play with it depending on what you're more familiar with. So every job has to have a unique identifier so you can document every maintenance activity that is done as a separate and unique piece of data. And then some identifiers for the equipment that you're doing work on, a barcode number, maybe the old inventory number, the name of the hospital, type of service then. Okay, type of service again could be a standardized term with a pull-down list. So it could be, are you doing a repair? Are you doing a scheduled maintenance or planned preventive maintenance? Maybe it's planned preventive maintenance with a repair. Maybe it's warranty service. Maybe it's outside service by a outside service provider. So it's important here to clarify what kind of work is going to be done and documented in this work order. Then some more specific equipment information about the equipment, who reported the problem, who's the reporting department? What was the date they reported the problem? And how was the fault reported by them? I know when I was running a biomed shop, we'd typically get a piece of equipment with a label stuck on it saying broken, please fix. You always want to try and educate your users to give you as much detail as possible when they're reporting a piece of broken equipment. What were the symptoms that led you to believe this equipment was broken? And the users often will report a fault which is quite different from what you find out when you've done some troubleshooting. So the next field gives you an opportunity to describe some troubleshooting steps, and then the following field shows what the fault that you finally actually identified was, which could be completely different from the fault that was reported by the user. Then there's a field to describe the actions taken and the outcomes. There's more. Did you use parts? What was the cost of repairs? Source of funding for the repair work or the parts? When did you complete the job? Again, if you've got the date that the fault was reported, as in the previous field, and then the date of completion, you can start to document the turnaround time for your repairs. And when you can do that, you can again identify equipment. There may be two different makes of equipment in the country, and one is taking, months to repair, whereas another one you can get repaired in a few days because parts are locally available. And so repair turnaround time is one of the reports that you can generate once you've collected data on completion date of your work and date that it was first reported. Of course, you need to know who completed the work, or was it an outside service provider, and any free field comments that you want to enter. And this is quite a long field. The comments field, I think, allows you to enter something like 255 characters, so you can be quite descriptive in describing unusual situations. So again, this is what the maintenance form would look like. It's similar to the inventory form. It starts with the work order number, which is a unique ID, which would be assigned within your health district, not necessarily unique across the country, because the database version that you're using on your laptop will assign these in sequential order automatically. So this number is assigned automatically in every instance of the database that's being used. So these are not unique across the country, but they're unique within a district. The barcode number, again, that's the inventory data. And then the rest of these are the fields as described in the list that I just mentioned. Again, you can have the same action buttons at the top. If you're looking for a previous work order, you would look for this. Maybe you opened a work order, ordered some parts, and then left it in an open status until the parts came in. Then the parts come in 3 weeks later, you have to go and find that record. So assuming you know the work order number, you can just click on Find Record, look for that work order number, and it'll bring up the information. And you can finish entering data on the resolution to the problem and close the work order. So that's just a close-up of the first few fields. In the maintenance module, again, the work order number, barcode, old inventory number, name of hospital, type of service. So we're going to implement drop-down menus for type of service and some of the other fields in this database. But the third module that makes this database data most useful is a reporting module. So the real power of a database is the ability to pull specific data out on specific categories of equipment, types of equipment, location of equipment. So, and I've just generated a sample report here on data from 2 hospitals in the northern, I think it's the northern district, on on oxygen concentrators. So I created a very simple report here asking for a list of all the oxygen concentrators in these two hospitals in the Upper East region, and the condition of those oxygen concentrators. So we found 4 oxygen concentrators. They all seem to be working, although one of them, we don't have data on their present condition. There's one of them in the Akaateba institution and 3 of them in Buisla District Hospital. So a very quick and easy report gives you the number of oxygen concentrators and their current functional status, which can be very useful for planning future equipment procurement. Okay, I'm going to talk now about steps in implementing a computerized maintenance management system, or implementing the database that we are proposing for Ghana, which is kind of a simplified CMMS. But in either case, it's not a simple, straightforward job to do this. And so it's important to understand that you have to follow through a number of steps to make this happen. And the first one, which is what we're doing today, really, and we're going to have we're hoping to have a subsequent webinar to go into a bit more detail about how you can use this database, manipulate the data, generate reports. So we'll basically be providing you with the structure and some of the drop-down lists to make it easier to use, but then we're going to hopefully you will be able to create customized reports that will help you do your job better. So staff training is the first step, which we're doing today and perhaps in a future webinar. Data collection, the inventory data is the next step. Without inventory data, a CMMS is completely useful to you. Data entry into the database from your Excel spreadsheets, or manual data entry into the forms that I was just showing you. If you haven't already created the Excel spreadsheets, you could start to use the software on a daily basis to document the work you're doing and constantly update the inventory with new information as you do work on the equipment in your hospitals. You can then start to use the database, generating reports to follow up, monitor the performance of your equipment, which equipment is breaking down more often, which equipment is more reliable. It's very important once you start putting this data into a database that you simultaneously create a backup system, which is in a completely separate medium than the hard drive or the SSD on your laptop, because laptops have a habit of crashing when you most need them. And if you've lost all of your inventory data inside your laptop, you have to start from scratch. So as soon as you collect inventory data in an Excel spreadsheet, you should create a backup copy, preferably on a USB stick or some external memory that you can remove from your laptop. And so it's less vulnerable to ransomware, viruses, corruption. You've got a backup copy if anything bad happens to the original copy. Now, a 7th step in implementing a CMMS, we're going to be starting with, everybody will have a copy of the database on their laptop to use to enter data. But then that data needs to be integrated into a countrywide system to be of the most use. And so, first of all, there'll be separate modules that each facility will be using, but then they need to be integrated. So that's the reason we need to go to a barcoding system where unique barcode numbers are assigned by the central office. That allows us, once we've integrated the database from all the different health regions, we can start reporting on countrywide trends and assist in equipment planning, assist in resource allocation, staff allocations, as we know where the most equipment is and where the most repairs need to be done. And once you have an IT infrastructure throughout the country, then you can start to have the IT infrastructure do automated backups for you, because IT people are much better at doing automated backups than clinical engineers. So once you get your database onto a countrywide IT infrastructure, and that may not happen for another 5 years, but that is definitely a future goal that need to be keeping in mind as we implement this system. And so I think that's where we're going to summarize the presentation today and open it up for questions. We've talked about the uses of an inventory, essential data in inventory, challenges in establishing an accurate inventory, described UMDNS nomenclature, computerized systems for inventory management, modules in the Ghana database, steps in implementing a CMMS. And then these are the two references we've used in this presentation. The World Health Organization has many useful documents, but two of them are an introduction to medical equipment inventory management and computerized maintenance management systems. These are free documents available on the WHO website, who.int, and look for the medical devices program under the WHO list of programs, and you'll find all of their publications. They have a number of very useful publications. Now, two things. We are recording this seminar, and it will be available on YouTube through the Ghana Medical Help website. And we'll be circulating that once we've copied this and uploaded it to YouTube, we will be circulating the YouTube link so that anyone who was unable to attend or came in late can watch this at a later date at their leisure. That was point one. Point two is we are encouraging everyone who attends to please fill out the post-webinar survey. So now I think we're going to open it to questions. Maybe I'll ask Martin to answer this first one. In capturing data for your inventory for systems that are integrated, such as an X-ray machine, you may have a tube, a collimator, or a generator with different serial numbers. In such an instance, do you record these parts separately in the inventory, or do you just capture it as an X-ray machine? Great question.
Yeah, very good question. We have chosen, for example, with an X-ray machine, to consider it all as one system. We've only given it one number, but for the entire room, with the exception of any components that might be movable, like if there was a mobile monitor cart, then we would give that a unique number. But for an X-ray room, we've typically just given it one number, and then within the database, we've kept a list of all the sub-assemblies with their serial number information. But to make things simple, we've just one number for a system.
And I'll just add to that, that may be a field we can add to the inventory database, because in some kind of distributed systems, you may want to have a separate inventory field and indicate parent-child relationship. So the parent is the kind of the room number, and the child would be a subsystem within the room. And so you can link them. And so that might be a field we add to our inventory database. So let's go to another
question, Bill, is, please, where do I get the UMDNS dictionary?
Okay. The UMDNS dictionary is available in a number of different formats. It's basically either a PDF file, which is just, it's like a big book with many thousands of devices. But it's also available as a spreadsheet, an Excel spreadsheet. So, and that's what we're going to be using to actually import a subset of the dictionary into your database. But both of those files are freely available. I have copies of them and I can circulate them, or perhaps we could put them up on it. They're in the public domain. ECRI has released them as no charge products, even though they spent a lot of time developing them. So we'll figure out a way to circulate them, or perhaps put them up, or share a link to a website where you can download them. They're very useful documents, and they'll help you to get a better appreciation of the UMDNS. So that's an action item we'll pick up and follow up on. Thanks for that question. Are these database modules being implemented in Ghana? How do I implement them in my facility? So we're working with John Zienaa to kind of flesh out this database program, and we'll be circulating and sharing them. They're basically written in Microsoft Access, and according to John, and this is a question for the participants, we're assuming everybody has a copy of Microsoft Access on their laptop, so they'll be able to run Access and manipulate the database, generate reports and things like that. And we'll talk a bit more about how to do that in a future webinar, hopefully in about a month's time. So again, to be circulated to all engineers in Ghana. Next question.
The question is, please, with the influx of Chinese-made equipment, may not have all the proper nomenclature and data. What do you do in case you don't get all the information? Well, the answer is you put in as much information as you can into the database. Often there's missing information, you know, such as purchase information or year of manufacture, those kind of details. With respect to the nomenclature, you do need to understand what the device is, that you can classify its generic name and specific name. But yeah, you just do your best to put information in. As Bill indicated, the inventory system is dynamic, so if you get that information at a later date, you can add it.
Yeah, most inventories are never complete. They're always a work in progress. We'll ask John to make a few closing remarks, but thank you everyone for attending, and I hope you found this useful, and please give us some feedback, because we're always looking to improve. Martin,
and Kelly,
thank you.
Did you want to make reference to the certificate?
Sure, thanks, Martin. So for everyone who attends this webinar, as well as who has attended our previous webinars by watching them on our website or in person when it happened, we're able to give a certificate of completion for everyone who attends these 5 webinars that we're doing. The way we're tracking attendance is by you completing the survey. So at the top of the survey, ask for your name, and that way we can mark down your attendance and know that you watched the webinar. At the end of every webinar is the survey link, so you can access all the surveys. The only one that doesn't ask for your name is the first one that was done in April. And that one isn't quite part of the set of 5. That one is specific to COVID. If you want to watch one that's specific to COVID, go back and please do feel free to watch the first one. Again, it's on the website that I posted in the chat here. And the survey for this webinar is just again posted in the chat at the bottom. The certificates of completion will be delivered after the 5 webinars. So that'll be at the end of September or October. If you have any questions about that, let us know. Please feel free to tell your colleagues, because again, you don't have to watch the webinars live to get this certificate. You can just watch all the videos on your own time at home and finish the survey afterwards to get the certificate, as long as you do all 5.
Is John Zienaa still online, and would you like to make some closing remarks, John?
I'm online, yes. Yes, I'm online. We want to thank you all, the presenters and our moderator, and also extend our sincere appreciation to all participants. We are grateful. And then this kind of webinars will continue to enlighten all of us. We appreciate your time. We know you are very busy, but you left all your schedules and then you made time to attend this webinar. We are very grateful. And anytime we have such technical meetings, we will indulge your presence and then join us to make it a successful endeavor. A few things about the software that the presenter spoke about. It's being developed gradually, and when it is ready, it will be deployed. Now, before it is being used, there will be another webinar in future to take clinical engineers through as to how it will be used. Now, if you want to know how to create set softwares using Access, we will take you through to do all that. So we thank you very much for this webinar. And then please complete the survey forms for us. It's very important. Thank you very much. Back to you.
Great. Thank you very much, Mr. Zienaa. Like I mentioned at the beginning of the webinar, we're looking forward to donating biomedical or clinical engineering toolkits to everyone, those who do not have such toolkits for maintaining hospital equipment. Obviously, we can't donate to everyone this year, but we're hoping that subsequently we would be able to cover up for everyone who doesn't have a toolkit. So how are we going to prioritize the limited number that we have for this year? What we want to do is that we've put in a survey, an application form that you need to apply for the kits for this year. Subsequently, those who would not be captured by this year, by way of, we are looking at the hospitals with the greatest need. So your completed application form will be looked at, and in terms of need, we would give for the first round of donations this year. Subsequent years, in order of priority, we would give to those who did not get this year. So I would, like I mentioned at the beginning, I would urge you to fill in this and complete this application form so that we are able to give the toolkits to you. Those who don't get the kits this year, we will still follow up with you subsequently in our surveys so that we still assess the need for these toolkits in subsequent years, as in next year. So kindly, we'll put up the link to the application, kindly fill it in, and then we can get to your toolkits in order of priority and in order of need.
I just wanted to comment. So the form for the toolkit application is in the chat. It's the first time we're accepting applications for toolkits across the country. So be patient with us. And we're just doing it with a small number of toolkits, like Dominic said. So if you don't get one in this round that will be evaluated over the next few months, then don't lose hope. We'll be doing this again likely in months and 12 months and periodically every year. So thank you, Pa. Thank you so much for attending this webinar. It's been a privilege and a pleasure. We will do our next webinar in approximately 1 month. You can, again, you'll receive an email if you're on our sign-up list, follow our Facebook, contact us anytime. If you have any questions, I'll add our Ghana Medical Help email address in the chat. Otherwise, have a great day. And thank you again for making the time. Thank you to our facilitators, to our our trainers, to Dominic.